Dr. Marty Makary, health expert for Johns Hopkins University and a New York Times best-selling author. Doctor, thank you so much for joining us.
Good to be with you. Thanks so much.
Great to have you. We're focusing here on your book, Blind Spots. Want to highlight that as well. Wonderful to have you tonight. You know, I'm curious, why do you think people's trust in doctors has tanked in recent years? And does this have anything to do with the COVID-19 pandemic in your view?
Yes, and the study that you cited is a real study. If I could just highlight that for a second. Trust in doctors and hospitals went from 70% down to 40%. That's a 30-point drop in just 4 years. There's a perception by many people in the general public that they've been lied to about natural immunity, about the importance of schools staying shut for a year and 9 months, about cloth masks on toddlers, and vaccine booster mandates for young people. But it's really a peek into a broader medical establishment where we've seen medical recommendations wrong prior to COVID. Food pyramid, peanut allergy prevention, hormone therapy for postmenopausal women causing cancer when it doesn't. So many people feel like sometimes there's an opinion by a small group of doctors at the top of the medical establishment, but it's put out as scientific evidence when it's not really supported by good data.
So a focus of the Senate roundtable tomorrow is the chronic disease epidemic. Can you tell us more about this specifically and what you're hoping to get across?
Sure. We have the sickest population in the history of the world. Half of our nation's children now are overweight or obese. It's 3% in in Japan. So what is going on? Are American children just more lazy and disobedient? Or have we poisoned the food supply? Children now eat so many ultra-processed foods and engineered food particles and ingredients that are basically chemicals. We've got about 1,000 chemicals in our food supply that have been banned in Europe and Canada. And sometimes companies like Kellogg will make 2 versions of Fruit Loops, one for Canada where these chemicals are banned and one for the United States where they're not. So we've got to start talking about the root cause of our chronic disease epidemic, and that's what we'll be testifying before the Senate tomorrow about.
You know, we've heard RFK echo some of these comments in the past. What can people who are concerned about this do in the current state, and what do you believe needs to happen within our government to change this so that our food is safe and we can trust our health care, in your opinion?
Well, we've got to talk about school lunch programs, not just putting every young child on Ozempic. We've got the most over-medicated population in the history of the world. 20% of our nation's kids now are on medications. So we've got to talk about the root causes in the food supply. Pesticides, for example. If pesticides kill pests, what do you think they do to the bacteria that line our GI tract, the microbiome, which is important for gut health? Those bacteria are important for immunity and digestion. Some of those bacteria produce serotonin. And new studies have shown that when you alter the gut microbiome, you actually introduce chronic diseases. There's been a strong association. I go through those studies in the book Blind Spots. But we've got to talk about health and not just our whack-a-mole healthcare system treating sickness.
Well,
I think we've done a terrible thing to doctors. We've basically told them to bill and code and treat patients in short visits, and we measure doctors by their throughput. We haven't given them the time or resources or good scientific evidence to actually talk about health and the food supply.
Thanks for watching. Go to joinnn.com to find News Nation on your screen. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.